Welcome. My name is Marnie Brickolo. My gender pronouns are she, her, hers, and I serve as the director of the UC San Diego Women's Center. Before we begin, I would like to point out the accommodations that are available for this webinar. There is closed captioning available with a link provided on screen and in the chat box. We also have an ASL interpreter on video today if you follow the instructions on the slide to change your view setting to side by side. On behalf of the Women's Center, it is my pleasure to welcome you to a conversation on a recent report presented by the Better Life Lab at New America, a bold policy agenda for work, family justice, and gender equity during COVID-19 and beyond. Today's program is part of our Women's History Month programming and encapsulates our theme of feminist transformations as we imagine a world grounded in gender equity and justice during COVID-19 and beyond. With the onset of the coronavirus pandemic in 2020, Better Life Lab spoke with essential workers on the front lines, child care professionals, elder care and home healthcare workers, parents, and caregivers who joined the Crisis Conversations podcast to discuss how COVID-19 has impacted their work, caregiving, and well-being, as well as the policies and programs that would help them survive the pandemic and thrive beyond it. Today's program will feature the authors of the Bold Policy Agenda, Roselyn Miller, policy analyst at New America's Better Life Lab, and Jahdziah St. Julien, research associate at New America's Better Life Lab, who will present on the findings of their report and join us in a conversation as they respond to questions from our campus community. We hope that today's session allows attendees to think about the ways that they can get involved and help to transform policies and culture so that we may together create a campus and broader community that is grounded in work, family, gender justice. As a reminder, you may submit your questions utilizing the Q&A function on your Zoom control panel, and we will address as many as possible following today's presentation. Now, I would like to welcome Roselyn Miller and Jahdziah St. Julien.
Hello. Thanks for having us here. It's so exciting to be able to join UC San Diego's Women's Center to present the research we've been doing on work, life, and gender justice as we center families and individuals who are just trying to get by in a pandemic and are facing exacerbated issues around childcare, around workplaces, really just looking at ways that we can improve policy systems to improve lives so people can thrive. So that was an excellent introduction from Marty. Thank you so much. I want to go over a quick agenda of what Jahdziah and I will be covering today. We'll start off with a quick introduction and an overview, as well as the research context that led to this policy agenda and the different things we were seeing in the data that made it interesting and important to really see how the pandemic was affecting women and caregivers. We'll share a bit about what we learned as it relates to paid time off, caregiving, and work redesign, focused on equity for Black, Indigenous, and Latinx women of color. And then we'll finish with some takeaways, policies, next steps, and get into a conversation with you all with any questions you might have. So I don't think I need to introduce myself anymore. Just a policy analyst. My background's in community-based organizing, so I'm very passionate about elevating workers and partnering with communities in order to create that policy implementation, make it more robust, and make it informed by workers. And at this point, I'd like to bring in Jahdziah to introduce herself quickly.
Hello, thank you so much, Roselyn, and I am so excited to be here with you all today. My name is Jahdziah St. Julien. I am a research associate at the Better Life Lab, where I work at the intersection of policy, gender, and also racial equity. So before diving into the policy recommendations that we included in our bold policy agenda, I think it's really helpful for us to take a step back and really understand what is the context in which we find ourselves and why are we making these recommendations right in the first place. So as many of you have probably seen, if you're scrolling on Twitter, if you've turned on the news, and if you've been checking your inboxes, there's a big story that's been going around. And that story is about women, and it's about the ways in which the pandemic recession has drastically impaired their economic and their financial well-being, and how women are also taking on themselves a larger weight as it pertains to caregiving. Next slide, please. So when we think about the economy, right, how have women been impacted by the recession that was induced by the pandemic? Advocates and researchers are referring to this current moment as a she-cession. That is a recession that is targeting and disparately impacting women, and especially women of color. The sectors that were hardest hit by the pandemic were sectors that were disproportionately occupied by women. So we're talking about leisure, we're talking about hospitality, and we're talking about retail sectors. When we look at the numbers, they tell us that from the beginning of the pandemic until this particular point in time, women have been losing their jobs and they've been struggling to make ends meet. In February, when the pandemic first hit, until April, when the pandemic hit its peak, women lost 12.2 million jobs. Later in December of 2020, 140,000 jobs were lost, and women of color lost all of them. Fast forward to January of 2021, and you have 2.3 million women still unemployed. Researchers have said that this particular point in time, women's employment has hit a 33-year low. Moreover, 57% of women, only 57%, are actively working or looking for work. When we zoom in to specifically women of color, so we're talking Black women, Latinx women, and Native American women, what we see is that the pandemic has hit them the hardest when we're thinking specifically about the financial and the economic impact of the pandemic. If you take a look at this graph here, which is from the Center for American Progress, what you'll see here is first on the top, some measurements from the 2008 recession, which demonstrate that over time, the rate of unemployment for women in general was pretty steady in decline. It wasn't a sharp decline. But when you look at the numbers from the 2020 recession, what you see are two things. First of all, when the pandemic first hit in the earlier months, there was a drastic drop in women's employment and participation in the labor market. Over time, you can see that there's been a gradual increase. However, when you look at the top line, which represents white women, and the bottom line, which represents Black women, you'll see that Black women have consistently suffered larger dips in their employment rate and have struggled to reach the same amount of re-entry into the labor force. And this is probably for two reasons in terms of the impact being so severe. Number one, we have to think about the labor market segregation. And what this means is that women of color, especially Black women and Latinx women, have been pushed into corners of the labor market, such as the ones that have been hit predominantly by the pandemic. So leisure, retail, hospitality, and other lower paying jobs. And this is not something that's happened all of a sudden. This is something that is a result of a history of labor market segregation, where women of color, particularly Black women, were pushed into domestic work. And so what we're seeing is a continuation of systemic racism, that has continued to have harmful impacts on women of color. And then we also have to be aware of the gender wage gap, which is making it even harder for women of color to weather this pandemic. On average, Black women are paid 38% less than their white male counterparts and 21% less than their white female counterparts. And so what this means is they have less financial resources, right, to make ends meet. And if you were to look at the gender and racial wealth gap, the financial repercussions of the pandemic have only been exacerbated for women of color. Next slide, please. Thank you. A major part of this conversation around women and their involvement and participation in the labor force market has a lot to do with the caregiving responsibilities that they have now had to take on. And it's really important to remember that prior to the pandemic, there has been a gender gap in terms of who has been providing most of the family and caregiving work within the home, and that has fallen predominantly on women. So it's really no surprise that when we're thinking about childcare and we're thinking about family caregiving responsibilities, that again, the weight of that is falling heaviest on women. And this has had a direct impact on their ability to continue working. So this graph, which is featured in a New York Times article, is in some ways similar to the graph that we just seen. If you look specifically at April of 2020, you'll see that, again, there's this sharp dip, right, in employment. But what you also see on this particular graph is that more men were able to remain in the labor force. The exit of women, particularly mothers with school-aged children from the labor force, the rate was higher, for women than it is for men. Even when the impact ameliorated, women were still feeling the brunt of the hit much more than their male counterparts with school-aged children. And so according to the Institute for Women's Policy and Research, the majority of women have had to stop working or reduce their hours altogether. And 64% of Latinx women have had to do this. Moreover, the unemployment rate, if it actually calculated for the amount of women who are dropping out of the labor force, that is, they're no longer continuing to actively look for work, I think we would see that the number, the rate of unemployment would probably be much higher. So as we mentioned before, childcare plays a very important role in this conversation about women's ability to actively participate in the labor market and regain their footing as well. And so when we think about what the childcare infrastructure looked like prior to the pandemic, what we know is that cost-wise, it was very unaffordable. In 2016, the Better Life Lab released a report called the CARE Report, which found that when it comes to how much parents pay out of pocket for childcare, the costs in some states actually mirror the cost of public university tuition. Moreover, 51% of families are living in care deserts, which means that the supply for childcare greatly is outnumbered by the demand for childcare services. And then when we think about the quality of jobs, right, they just weren't great prior to the pandemic, and they still aren't. Women of color who make up 40% of the childcare workforce, and so we're talking Black women and Latinx women predominantly, they don't have benefits. They aren't receiving adequate pay for the work that they're doing, which is essential prior to the pandemic and of course now. So now when we fast forward to where we are at this moment, researchers and advocates have told us that the childcare infrastructure is quite frankly in shambles. NACI, which is the National Association for the Education of Young Children, put out a survey in April of 2020 in which they found that 50% of surveyed childcare providers had to close their doors. And from the Center of American Progress early on in the pandemic, again, they estimated that without robust investment in the industry, 4.5 million childcare slots were set to be lost. At this current moment, there's an estimate of 20,000 centers closed with concerns that they may not be able to reopen after the pandemic and in the long term. So before we head into the second part of our presentation, I just want to contextualize how we're going to be using some of the stories and the quotes that you'll be seeing. What we did, as Roselyn explained, is we took the stories and the quotes from participants who joined the Better Life Lab, a Crisis Conversations podcast, to drive the policy recommendations that we're making. And the reason why we wanted to concentrate on their stories is because oftentimes when we have conversations about policies, they tend to be in some ways separated from the human existence and the very people these policies are meant to help. And so we want to, of course, provide the technical language and aspect of the conversation, but we also want to humanize who we're talking about and why we're making these recommendations. So Jocelyn Fry, who's a senior fellow at the Center for American Progress, said this when she joined the podcast. Black women and women of color are bearing this economic burden. They're also being treated unfairly in terms of how they get paid and are disproportionately in low-wage work that lacks benefits like paid leave, paid sick days, the very things that people need right now. So Roselyn, I'm going to hand it over to you to kick off our policy recommendations.
Thanks for that, Jahdziah. That was phenomenal background on a very real issue. And I think right now it's important to just pause for 1 second, take a deep breath, because that was devastating data. And sometimes when numbers pop up, it's easy to just say, oh, okay, let's just move on to what we can discuss to make it better. But just pause and feel the impact that women of color, essential workers are bearing the brunt of their daily lived realities. So quick pause, deep breath. Okay, moving on. So the bold agenda that we created, thanks to Marnie, thanks to Jahdziah for providing more context on exactly how we came across the workers' stories and the researchers and experts that we wanted to include in this. So let's just get started with the first. It was broken into 3 sections. We'll get started with the first section, which is paid time off and the recommendations around that. So of course, in a health pandemic, paid sick days are going to be one of the most essential policy measures that we can provide to workers in order to take some time off if they feel sick, reduce the spread of the virus, and take care of themselves and their families. Prior to the pandemic, only about a quarter of the US workforce had access to even a single paid sick day. And workers who did have access typically only had 5 to 9 days for the year, and those were subject to restrictions around how they can utilize those days. So that's just leaving a lot of people who are unable to take care of loved ones or take care of themselves if they were sick. Universal paid family and medical leave is a longer term medical leave benefit that would allow people to take extended periods of time off if they need to care for a newborn, whether to recover or to bond with that newborn, or to take care of family members outside of that and themselves. And we like to have a very inclusive definition of family when we talk about paid family and medical leave, because a lot of times grandparents are taking care of younger kids, or maybe the neighbor has been a longtime family friend and is almost like a relative to you. And so having the choice to be able to use that allotted leave to take care of the people who matter most to you and still retain your job and not be scared of retaliation and be able to pay the bills on time is so incredibly important. And the paid caregiving leave provision that was passed during COVID, it helped a lot of people get emergency access. And when it expired, a lot of people lost that access. And it's just such a critical benefit. At some point in every person's life, whether you have children or not, often there will be a medical issue that will require taking time for yourself. And so this is something that we just need for every single person in the United States. And the United States is an outlier in that it's a wealthy, it's one of the only wealthy nations without a federal paid family and medical leave plan and paid sick days as well. And then one more thing on paid sick days, while we're here, it really works. During the COVID pandemic, mandatory paid sick leave reduced the number of infections by 400 people per day per state in states that previously did not have paid sick time requirements. And it encourages testing and reduces the spread of the virus. And then finally, for the paid time off section here, I really would love to cover paid annual leave. One thing that often gets discounted or left out on the conversation of leave is the idea of rest and leisure. Not only is it important to take time off to take care of yourself in a medical situation or caregiving situation, but also to take a break from work once in a while and be able to increase your creativity, your productivity, and have that long-term planning without paid annual leave, or paid vacation days is the more common term. It's very hard to have that long-term planning, and behavioral science shows that we get caught up in the day-to-day thinking, and with some time for rest and leisure, we're able to plan out our lives and plan out everything else more robustly. For paid annual leave, 1 in 4 workers, most of them earning low wages, have no access to paid vacation days at all. And all workers should have the benefit of paid time off. So another quote from Richard Gegic, who works at a restaurant, is an organizer, discussed the ways that workers feel compelled to go to work when they don't have paid sick days. And research shows that workers are 1.5 times more likely to go into the workplace, even if they're feeling sick, when they don't have access to paid sick days. This has negative repercussions not only for their personal health, but for the health of their coworkers and anyone around them as well. And then quick update. So when the Families First Coronavirus Response Act expired, the emergency paid sick days and the caregiving leave that was provided expired as well. And now a lot of people are without this crucial benefit. And while we've seen signaling from President Biden toward including paid family leave in a Build Back Better robust plan, in the short term, workers are getting left behind, and the current stimulus package includes tax incentives for businesses that are wanting or willing to continue providing paid sick leave or paid family medical leave. But this is not a mandate, and it's such a crucial benefit, and it needs to be included in any future policies because this has equity implications, and it's hurting women of color more because not only are there tends to be a push into lower wage work for people of color, and lower wage work tends to have fewer benefits associated with it. And frankly, this is a popular policy. Three quarters of voters support permanent paid family and medical leave. I get passionate about this. So they support permanent paid family and medical leave. This is not a partisan issue amongst families. It is only partisan at the level of politics and legislation. So there's lots of options out there right now. One being the Family Act, which would provide 12 weeks of paid family and medical leave, for example. On the Hill through a social insurance fund that everybody pays into and everyone can draw out of. And then there have been other recommendations looking at tax incentives or borrowing from Social Security, but those are less popular because it would borrow and reduce people's ability to save for retirement long term. So really a social insurance program, 12 weeks of paid leave minimum is really what people need. I'll pass it over to Jahdziah to talk about caregiving now.
Thanks, Roselyn, for opening us up on our policy recommendations. So for caregiving, we're really thinking about how do we rebuild the care infrastructure and how do we support family and professional caregivers. Once again, if we want to promote gender equity within the home, And if we want to ensure that women are able to re-enter the labor force at a rate that is not lower than, but at almost equal to, if not equal to specifically, as their male counterparts, then we have to think about investing in a care infrastructure that is robust and that can support their needs. And it's worth mentioning that because women have predominantly been providing this work, having an infrastructure in place that enables them to pursue other opportunities and opens them up to opportunities to build financial security, I think is really, should be at top of mind for all of us. And so our policy recommendations really center around investing not only in childcare, but also in elder care, which oftentimes in conversations around caregiving is sometimes pushed to the side or just not recognized. So we also think in terms of the short term and the long term. So in the short term, for childcare, we are proposing that there be a robust financial investment in childcare industry to ensure that providers can survive COVID-19. So what that might look like is, for example, ensuring that childcare providers have the financial resources that they need to purchase PPE equipment. For those that are staying open, especially those who are staying open to serve the children of essential workers who are on the front lines, these financial resources would be extremely important because they wouldn't have to rely on using their own money to purchase essential equipment to keep themselves safe and to keep the children safe. But more importantly, it would also enable them to continue operating. It would enable them to keep the lights on, to purchase supplies and food for the children, and also to continue paying their workers, because without workers, the services simply cannot be given. Also, when we're thinking about the long term, we're thinking about ways to strengthen infrastructure through an investment in training programs and efforts to attract and also retain childcare workers. When we look at the elder care system, thank you. When we look at the elder care system, we want to think about ways to continue supporting home health workers who face some similar issues as childcare workers, particularly around having access to PPE. Earlier in the pandemic, that was a major issue. Many healthcare workers didn't have access to it. We spoke to one healthcare worker, Brittany Williams from Washington State, who luckily through her agency and also through a joint work with Washington State and local agencies within the area was able to get access to PPE. And that helped her feel safer when she was giving care to the patients that she was working with. And so we also need to think about, in the long term, how do we not only support professionals who are providing care, but also support the family members who are providing care, either to elderly family members, to adult or children who have long-term disabilities and illnesses. And what we propose is robust investment in training programs to equip family members with the knowledge that they need, as well as the support that they need to provide this crucial care. So here's a story from Carrie McCracken, who is a mother of 5, and she basically shares with us her desire to go back to work, her excitement about getting a job in the midst of this pandemic, but ultimately her inability to take on the job because of a lack of childcare. She said, "I loved the company, I loved my job. I was so excited to still have a job. But then it hit me once I started calling around for childcare that this is not possible. Our childcare centers were operating around 15 to 20% capacity, which means there was no hope if you were someone new coming in." So her story speaks to the need for childcare and the way in which, for her, the lack of it prevented her from entering back into the workforce. So what are some outcomes and some updates that have been happening on Capitol Hill? First, we can talk about the CARES Act, which was passed in March of 2020, which allocated $3.5 billion to the childcare industry. This money was to allow childcare providers to purchase the PPE equipment that they needed and to also maintain their operations and to pay their workers. Unfortunately, in May of 2020, the funds eventually dried up. In December of 2020, there was pandemic relief legislation that was passed, that allocated $10 billion to the childcare industry. Moving forward, right now, COVID-19 bill that is currently in Congress, it passed the House, is providing $40 billion to the childcare industry. Altogether, that would amount to $50 billion if that specific legislation is passed. Since the beginning of the pandemic, childcare advocates have been calling for $50 billion for the childcare industry, not only for the short-term response to COVID-19, but especially for the long-term response as well. President Biden has demonstrated a willingness to invest in rebuilding childcare through his Build Back Better plan, in which he discusses his goals for trying to improve and also maintain the working benefits for childcare workers as well as their wages. So why does any of this particularly matter for the conversation that we're having now about women of color and also about equity? Again, remember that when we're thinking about the childcare infrastructure, when we're thinking about the workers who are sustaining it, who are caring for the children, who are supporting our nation and our economy, they disproportionately are overrepresented by Black and Latinx women, right? So when we're talking about the jobs that were lost, we're talking about jobs that disproportionately were held by Black women and by Latinx women. And so when we're thinking about the need to invest, we have to think about how do we make these jobs that are good jobs, jobs that are good paying jobs, because for far too long, we have undervalued the labor and the contributions of women of color, and specifically of Black and Latinx women. And so this is a conversation not just about getting people back into the workforce or promoting gender equity, but it really is a question about addressing and redressing centuries of undervaluing labor and thinking about how to build in equity within the systems that we are rebuilding for a more just and equitable future. So I'm going to pass it over to Roselyn once more.
Great. I think that was such a great intro for what inspired our work redesign section and the policies that we really wanted to focus on to zero in on that would not only help during COVID-19, but in the future, specifically centering on policies and how we can look at them both in the professional setting and also in the gig economy setting and in low wage work and across the spectrum of where workers are. And then also when someone, loses their work, how can we as a nation collectively come together to support each other in community and ensure that people can balance crisis, balance that unemployment with the ability to search for jobs, take care of their kids, go to health appointments, and a slew of other things that happen in life. And we want to do this, but with centering Black, Latinx, and Indigenous women of color, because right now they bear the brunt of most of the fallout of the pandemic. And by centering the margins, by centering the people with less power, we can ensure that all policies are as inclusive as possible and make sure that there's equitable access to the policies that we do implement. For example, the Paycheck Protection Program. We need to be able to know what the small business access rates for women of color owned businesses were and know how to improve the implementation, the access to small business loans and grants and support entrepreneurship, as well as within that, looking at anti-racist workplace policies, fair hiring practices, ways that management can lead DEI and lead the efforts to improve a more robust, more equitable system. And then also where we're carving out, I'm saying we, but I mean United States policymakers, because this has been a series of active choices that have led us here. This is not something that just happened. Our policies have created this system where we've intentionally carved out people in agricultural work, people in domestic work, and those jobs are disproportionately held by women of color. And by carving out those businesses and those industries, also carving out small businesses and also excluding large businesses and policies, we leave out some of the people who could benefit the most from workplace redesign. And then a little bit about unemployment benefits. They're so crucial to so many people. Crisis happens, and we know that there's equity implications with this. We know that the Black unemployment rate is twice as high as the white unemployment rate. And we know that by improving unemployment benefits, people have just a little bit more grace to keep their housing, keep their kids fed, and go and pursue work that they can find, knowing that they're set and their basic necessities are met. And then Jahdziah got into this a little bit with the conversation around personal protective equipment for childcare workers, but it's absolutely essential to protect workers' health and safety through OSHA regulations, and really emphasize that workers in low-paying jobs have limited rights to keep themselves safe and without risking negative repercussions when they request better safety equipment, better policies, and accommodations for their health. And we define health broadly, not just their physical health. So not just, working in the hot sun or working in a fuming or dangerous work environment, but also mental stress and anxiety, which we've seen incredibly exacerbated by the COVID-19 pandemic. And then finally here we have supporting remote and flexible work arrangements and predictable schedules. So this is the idea that we should be able, if we can, if we're in an environment or a job that can be done online, we should be able to do that job flexibly, remotely, knowing that when we do go remote though, we don't know what people's home situations are. And often, if you have a small child to take care of, that small child is going to have random needs throughout the day. So in order to protect that and to acknowledge the whole human, we need to be able to scaffold flexibility into a worker's schedule. And then this isn't just for professional work as well. If your work is frontline, it's with people at a grocery store, if you're cleaning or anything like that, predictable schedules are such an important policy that allow people to control when their hours are and how often they go in, and really balance that with their other home and competing priorities. It's especially important for hourly wage workers who getting their schedules ahead of time is absolutely necessary in order to book life long-term and not just in the short-term day-to-day. And we've heard horrendous stories of people being texted the morning of, like, come in or you're fired, texted the night before, like, this is your schedule for the week. There's no flexibility around it. And so we really need to be able to see workers across the wage spectrum as having self-directed lives and control over when they can work and when they need to work as well. Okay, this is a large quote, so I'm going to pause for 5 seconds just so that y'all can have a chance to read it. So Jamie Glachet, one of the co-founders of Native Women Lead, really drew attention to the issue of women of color-owned businesses, particularly suffering during the pandemic. And it's unacceptable to allow this continuing inequity, this continuing divide. And unless there are policies in place now, we will see the wealthy get wealthier and those who are marginalized, those who have less systemic support around their businesses, around their lives, around what benefits they have access to, we're going to see inequity just increase, and that gap between who has access and who does not have access just exponentially expand unless we create protections now and we center women of color. Some outcomes and updates related to work redesign. We saw a second stimulus check of $600, and there's current conversations for a $1,400 stimulus check, but this would be more limited to single income households of 80,000 getting it, or dual income households up to 150,000 getting it. That is limited, and it is not expansive. It is not a universal basic income, but it is a little bit of a help toward the stimulus and toward allowing people to get through to the next stage of this pandemic as people continue to lose work, even as the vaccines are rolled out. And frankly, we need permanent updates to the U.S. work infrastructure. They cannot be wrapped into temporary provisions, because there's just so much research that shows how much this can improve people's lives and productivity for businesses and outcome for businesses. But more importantly, just the day-to-day ability to balance that work and family, those work and family needs, and also leisure. And then we know that the workplace inequality exacerbates the wealth gap, and the wealth gap. Just a quick thing on the wealth gap: white family wealth is 7 times greater than Black family wealth, and 5 times more than Hispanic family wealth. Black families face more health disparities and tend to experience more interpersonal and systemic racism that affect all aspects of life. We're thinking about ways to improve equity and work redesign through our work at the Better Life Lab as well. And we've been studying overwork and health through a project on American karoshi, which is a Japanese term referring to death from overwork. These policies, if put in place, could help people's health and help people deal with work-life burnout and the stress as life and work becomes more and more integrated. And then another project that we're looking at to really innovate on what work looks like and can look like specifically for care providers and parents who access childcare is a mapping project around any innovations that are happening in the public or private sector, or through collaboratives or partnerships around childcare innovation, discussing the levers that Jahdziah outlined earlier: affordability, access, and job quality, and quality of care and curriculum as well. So any innovations, we've just launched this project and we'll be releasing more information on our site as we go through. And a key part of all of this is just changing the way care provider jobs look and the way that parents can be protected at work and have access to those policies that really support them. Okay, so just to wrap up, I know we're at time, some takeaways and next steps. We spoke with Justin Rubin, who works a lot with parents, and he pointed out that this is just a phenomenally different experience. This pandemic that we're all going through together. It is one of the hardest things that's hit us, and parents are really feeling it and really experiencing these issues as they balance just so many responsibilities and pull out of the workforce, particularly women pull out of the workforce. So we really need to take this moment and view it as a moment of change, as a moment where we can come together and pass policies for our communities and for equity. A quick recap of the policies that we did cover today. I'll included guaranteed time to care with workplace protections, job protections that allow people to take these regardless of where they land on the wage spectrum. Building a better care infrastructure, a robust care infrastructure that's holistic and incorporates care provider work, as well as the needs of parents, as well as the needs of children themselves with high quality curriculum. And then finally, we discussed anti-racist, equitable work redesign policies for specifically that could support women of color, but would also largely support all people, and to extend and improve unemployment benefits, emphasize health and safety and create protections around that, and then continue to support remote and flexible work arrangements, frankly, even after the pandemic is considered over. At this point, we'd like to open up for questions, and our emails are here in case anyone would like to jot that down quickly and reach out to us after this. We're happy to answer any email questions that didn't come up during, that doesn't come up during the Q&A. Otherwise, I think I'm going to stop sharing my screen and get ready for the conversation.
Thank you, Roselyn and Jahdziah, for sharing this important research with us today. So like Roselyn said, we are now opening up the session for questions and conversation. We've collected some questions from attendees during the webinar registration and have received additional questions during the presentation. As a reminder, you can continue to submit questions using the Q&A function on your Zoom control panel, and we will get to as many as possible. So with that, my first question for you all today is, you talked a bit about the different policies and things happening in Congress, and I just wanted to get your thoughts on the current $1.9 trillion COVID relief package. I know that it's still working its way through Congress and there might be changes before it reaches the president, but what do you think it gets right, and where is it still lacking as it relates to issues of work-family justice and gender equity?
Well, I can open this up. Thank you, Marnie, for opening up the Q&A. So I think one thing that this legislation does get right, and something that we had a chance to discuss in the presentation, is the funding that's provided for childcare. Again, when the pandemic started, there was a request of $50 billion that advocates had put out to congressional lawmakers. And for a very long time, they've been waiting for robust commitment to that amount. And so I know that a lot of childcare advocates are very excited about this amount, the $40 billion. However, they do want to emphasize that there should be a focus on not just a short term, but also like a long-term investment for the future. So the messaging around that is, this is great, but let's keep that going. As it pertains to our recommendations around paid leave, what we do know is that at the moment, there are no mandates that businesses provide their workers with paid family and medical leave or paid sick leave. And as Roselyn discussed in the presentation, there were universal national basically policies. Although they had major exemptions, they were very helpful in supporting workers and their families. And so that not being in the current legislation is, I think, one area of concern that we hope will be addressed moving forward in future legislative packages. But we do know that on the right side, to what extent this might be helpful, we're hoping it is. There are tax credits that Congress is using, I think, as incentives for businesses to provide paid leave to their workers. But again, this is something that is very much leaving it up to the desires of employers and is not really guaranteeing that this benefit is accessible when it's so desperately needed.
I just want to add to that. One thing that we didn't include in our bold policy agenda was the fight for a $15 minimum wage, which was a huge part of the initial part of the stimulus package and then was removed. We are looking into seeing state level advocacy, and we're seeing a lot of bipartisan momentum around this $15 minimum wage. And so that is something to keep an eye out as a way to support low wage workers and ensure that they are able to make enough for basic necessities.
Thank you both for sharing some of your thoughts on that and some of the continued work that's needed both at the state and federal level. The next question involves, so prior to the pandemic, some leaders and supervisors were skeptical of flexible or remote work arrangements. What would you say to those supervisors to encourage them to continue exploring these possibilities post-pandemic? And what advice would you give to employees advocating that access to flexible or remote work continue after the pandemic?
Yeah, it's 2021. We have the technology. We can go remote, and often I think that there are some biases around monitoring workers and watching them and making sure that they're working, but there are workplace processes, clear deadlines, clear expectations that we can put in place in order to make remote work possible and also beneficial to people who are balancing so much more at home, especially as we can't control what is and what isn't available to go remote. We don't know what's going on in people's homes and families and whether people's partners are having to go into office, into high risk environments, or whether people's children are expected to go into schools where we've seen, sort of conflicting research, but stuff that shows that it does increase the risk to COVID in some places unless there's proper protections given to teachers and to students as well. Yeah, and then to the point on advice to employees who are advocating for flexible or remote work, I would say to be honest about the need with your managers as much as you're possibly able to say like, hey, this is a benefit that would cost you nothing and would give me so much, and this is the ways that it can improve work, and these are the ways that for me it would work better. And then of course to take that out of just any professional environment, any environment that can work on a computer, and extend those provisions, specifically job protection and schedule stability, to any hourly workers who have to go into the office, or contract workers who support the larger program, but not necessarily through computer-based or professional desk research.
Thank you. I love the idea of it costing nothing, but the kind of return on something that doesn't have a cost associated with it, but can really benefit employees. So my next question is that, so here at UC San Diego, many of us are lucky to have access to better work-family policies than many employed elsewhere, and many that you cited within your report. However, even with this, many employees remain burnt out as any sense of work-family balance has been eroded. What are your thoughts on how employers can better support staff, especially those with caregiving responsibilities during these stressful times?
Well, I think first of all, I'm really happy to hear that UC San Diego has, policies and structures in place to support workers and to ensure that they, have access to time off. But I think what's really important is not just having the policies, but also having the culture to accompany the policies. Because something that we've found in our research and in larger research around paid leave taking in particular is that if people don't feel safe taking time off from work, if people worry about workplace retaliation from their coworkers or from their bosses, or if they feel intimidated about asking for time off, even if there's a policy in place, they're not going to take it, right? And so I think that's something that would be helpful for supervisors to do, is to ensure that there is a culture that enables for workers to take time off, and that workers feel that that's an option that is available to them. And so again, a lot of the recommendations that we made in the presentation are things that not only can be implemented like at the legislative level, but can also be implemented in the workplace. And so our hope is that employers will really think about what does a robust paid leave policy look like, right? Is it inclusive of parents who are not only women, because a lot of policies around parental leave actually target maternal leave and leave out men, but also are gender inclusive as well? How do we ensure that when we're talking about paid sick leave, that we are not being limited in terms of what counts as sick or illness, right? And so there's the employers can play, but then there's also like the role that we expect legislators to play, right? Because this is not something that we think can be solved by just the private sector or by individuals alone. These are structural issues that need to be solved at a structural level.
Yes, thanks for that. And I think that cultural shift is so important, right? I think even, there's always a reason to push yourself harder, go in sick. There's always a meeting or a program or something happening. So really kind of changing that frame of mind, even post-pandemic, so that folks feel safe to take care of themselves when they need to. The next question I have for you is, so in the report and in your presentation, you talk a bit about the importance of creating anti-racist workplaces. Could you expand on this and discuss the ways that anti-racism is critical and intersects with work, family, justice, and gender equity issues?
Yeah. Oh, go ahead, Roselyn.
No, I was just going to sort of divide out the anti-racist workplace policies and then the address the systemic racism and how those policies actually look really different. And one of them, anti-racist workplace policies can be implemented within employer-based models through proper training. Maybe that training includes specifically understanding white supremacy culture at work and how that proliferates, and perhaps understanding the different things that come into play. I saw there was a question in the chat about ways that, or not in the chat, sorry, in the question and answer about ways that we can talk to managers about going from the type control and monitor environment versus the trust and flexibility environment. And I think that trust and flexibility environment is a huge part of anti-racist workplaces, because we know that interpersonally, women of color in the workplace tend to face higher repercussions and have stricter expectations around what's supposed to get done and less trust in the workplace. So the more we can improve not only training, but implementation around that and see how we can integrate new policies in the workplace, whether that's transparent salary bands or flexibility that is clearly communicated and clear expectations and defining really specifically what success means in the workplace. So that's the anti-racism workplace side. And I didn't want to interrupt Jahdziah if you had anything to add there.
No, I didn't. You covered it actually for me.
Thank you. And we got another question, and this kind of goes through kind of tying in how all of this work is connected, but can you draw some connections between the work that you all are doing and efforts to advocate for comprehensive immigration reform?
Oh yeah, I can talk about that. Definitely. Pathways to citizenship are such an important part of getting people access to benefits like paid leave and getting better job protections in the workplace. Know Your Rights campaigns have been incredibly important in showing people what's currently available to them. But frankly, there's fear and stigma within the Latinx community that if someone even is protected and even when they have access, that the usage rates are really low because of fear and mistrust of government services, or the fear of becoming I'm blanking on the term right now, of relying on public benefits and then getting that little mark that might prevent them from a visa application or a green card application. And so immigration reform is such a key part of supporting the workforce, not just in the Latinx community, but across different cultures within the United States. And every single cultural community has their own immigration issues that they've been battling. I know within the Asian community, there's been a lot of immigration reform tied to businesses and the way businesses draw in family members and things like that. And so comprehensive immigration reform would look at targeted populations and see exactly what the issues within those communities are in order to include them and to expand and make just more accessible, inclusive, and easily to understand ways to immigrate into the United States and to become to access these things. And then just one more thing I want to add on this, because it's such a passion of mine, is specifically multi-status families. When we talk about immigration, often we think about the individual person dealing with immigration issues, but people exist in systems and people exist in families. And often one person may have documentation status and another might not. There might be parents without documentation with kids who are citizens. And with the stimulus package, we saw there was a huge lack of stimulus going to people who did not have documentation, even if their kids were here, even if they were paying taxes here, and they were just excluded, even though they were incredibly in need as much as anyone else.
Thank you, Roselyn. Those are really some powerful connections about the importance of immigration reform as it connects to what we've been discussing today. Another question that I have for you is, can you speak more about what you think the role of employers might be in investing to create access to emergency and backup childcare for employees, and any best practices that you've seen around this issue?
I can start this one off, and I think Roselyn might have a few thoughts about this as well. But I guess first and foremost, I do want to acknowledge, and I know this is something that we keep emphasizing and hammering home, but we at the Better Life Lab have this understanding that there is a responsibility of the government, right, to provide services to families and to workers. And a lot of times the onus is placed on individuals and or the expectations are placed upon the private sector to solve these issues alone. At the same time, though, that being said, we do think that there is a place, right, for public and private innovation in finding solutions. And so one thing that we would like to think about is, what if there are ways for employers, in a sense, to ensure that there isn't even a need for emergency childcare? So what does that mean? That means thinking about ways to create opportunities to ensure that parents always have access to childcare. So that could be creating childcare centers at the workplace, right? So that if a parent needs quick access to childcare, it's readily available. That could also mean providing parents with maybe childcare stipends. So if an emergency arises, right? Let's say like things actually do happen, but it's not like a parent has to dig into their reserves to fund that immediate need for a childcare service, right? Because their job is providing them access to that stipend that is readily available. So it doesn't feel like an emergency, but it's like, I am prepared and I feel supported in this particular instance. And I think another idea could just be businesses pushing policymakers to think about, creating a robust childcare infrastructure that has services for parents that are outside of the traditional 9 to 5 p.m. Kind of time slot. So that means that if something happens, the car breaks down at 5:30 p.m., maybe you can easily call a friend and they can pick up your child from maybe wherever they might be, like school, and then drop them off at a childcare center that's readily accessible and that doesn't close until 12 a.m., right? Because it's open for parents who are working different hours. And so I think that's kind of how we think about, ways to empower businesses to help parents who need immediate childcare. Basically creating situations where it's not an emergency, but it's like, we know we're prepared and we know that we can depend on our businesses and our employers to support us.
Thank you. Kind of going back to what we were talking about earlier regarding conversations in the workplace, the need to shift workplace cultures. We got a question about what are your recommendations for employees who are nervous about creating conversations in workplace environments that are less supportive? Thoughts on that?
Yeah, that's very real. That is a very real issue, and frankly, there's power dynamics there. If you're coming from the employee side and pushing for change at the management level, that maybe you won't be listened to as much, or you'll come across as wanting to like do less work. But it's important to push for the, and I know this is hard, but it's important to push for the policies at the local, state, county, federal level, and then have those protect your jobs and affect your employees, and also to share information with them if possible on the benefits to the business, and really frame it as an issue of, look, this is good for me, but this is even better for you. And sometimes those, business case for childcare, business case for flexibility, they can fall a little bit short and be a little bit more capitalistic and focused on the profit side of it. But I think in supplement with the case for human-centered thriving, that we can really together create those, as Jahdziah was saying, public-private partnerships to improve policies, and then push it from the government side, and work in tandem with the whole ecosystem. Did you have anything you wanted to add to that, Jahdziah?
Yeah, I did. And I think that was a great answer, Roselyn. I think something else that I would advise is creating an environment in which people feel comfortable talking about their childcare or their family responsibilities and caregiving needs. And it wouldn't necessarily have to immediately be with the manager, but something that could happen just from the day-to-day conversations. So for example, not being afraid to mention, my child had an accident, with cereal this morning, and there's 5,000 grains of Cheerios on the ground. And so I couldn't answer your email. And that being something that's understood and is taken with grace. So I think normalizing the reality that people have families that they're taking care of before, after, and during work, hopefully will create the environment in which, when people do have to have these conversations with their managers and their coworkers have already been exposed to the reality that people have to care, and they will eventually need time for that.
Thank you both. And yes, I think that the point of normalizing caretaking is a very important one. And on that note, my next question for you all is, one of the recommendations that you discuss in the report is to create caregiver discrimination legislation to make caregiving a protected status under civil rights law. Could you talk a little bit more about this, why it is important, and what that type of legislation might accomplish?
Yeah, definitely. Yeah, I believe this was in the context of caregiver and pregnancy discrimination, and making it a protected status, because frankly, it's cruel to fire someone for being a caregiver, for literally doing the essential work of like creating people, and also just living their full lives, and those are their personal lives. And a lot of people, for a lot of people, caregiving is also an identity. And to protect pregnant workers would mean that we would also retain more women in the workforce and create safer, more equitable environments for women to advance throughout their jobs or careers, or whatever it is their paid labor is. Or if they have needs or accommodations in the workplace, say the need to pump or the need to leave work just a little bit early because their early childhood educator or professional caregiver was no longer able, had to close early, or was no longer able to take care of their child. Ways that they can do that and then know that they can come back and still have the financial stability to put food on the table is incredibly important. And frankly, as we say in the report, pregnancy discrimination in particular is alive and well today. And pregnant workers face just so many challenges and difficulties with managers saying or making assumptions based off of their ability to get work done, but frankly they're not true, and they're based in biases around women and the patriarchy. And by extending protections to caregivers and pregnant workers, we can really protect who has access to safety at work and who has access to knowing that they can live their personal life and be protected at work.
Thank you. Another question that we got is, could you talk about any specific recommendations specifically to support single parents, or anything that you can highlight in that area?
Yeah, I think one important thing to note with single parents when we look at the policy infrastructure in the US is that for a long time, a lot of policies were made to really center the nuclear family, the white heterosexual nuclear family. And that's just, it's just not how life is. It's not how people are. A lot of people don't choose to be single parents, and whether they do or don't, they need to be supported in taking care of their kids. And what we see a lot is that single income households with children will have access to less money than dual income households with children. And we see that through tax credits. We see that through any policies on cash allowances, even healthcare, Social Security, and a couple other policies. We see the benefits level just increasing for dual income households. And frankly, if you have a dual income household, you have two incomes coming in, and you have more money to support the kids that you have compared to a single mother. And so it really should be that, or a single father, or single non-binary parent, not to discriminate, but it should be that if you are a single parent, then you should have access to enough resources that center the child rather than your status as a single parent.
Thank you. So we have time for just a couple of more questions. So one question that we have is, do you have any advice or suggestions for parents, including new parents, on how they can navigate this time during the pandemic?
Yes, we do. I think definitely something that we would suggest is to make your workload clear to your managers, to your supervisors, to your coworkers. If, for example, you have a new child that's come into the world, your main priority is to keep the child alive. And even if your child is not a newborn or newly adopted, your main priority will always be to keep your child alive and healthy and safe. And that takes work on your part. And so I think that making it clear, what your boundaries are, what your needs are, is something that's could be very helpful to new parents and to all parents. I also think that we also think that it's important to communicate your needs in a way that is honest, right? And is not afraid to share what exactly it is that you might be experiencing. Of course, though, it's important to acknowledge that that's not always going to be possible, depending on who it is that you work with or what your workplace culture is. And so in those cases, when you aren't necessarily able to advocate for yourself or for your coworkers even, it's important for us to think about what are the policies that are going to empower us to either state our needs without fear of retaliation or discrimination, or to have access to those benefits that we would be requesting from our managers and supervisors. And so voting for paid family medical leave, voting for paid sick leave, really thinking about, in the long term, what are those policies that would be helpful to me and to those who are like me. And then also at our job, at our team, at the Better Life Lab, we have something called BLLX, which is Better Life Lab Experiments. It's this really cool, innovative project that basically combs through the latest research around caregiving, gender equity, and tries to think about some solutions that families and individuals can implement within their own homes to promote gender equity. Because the way that we think about it is gender equity begins in the home, and also is a conversation that happens outside of the home. So while we're pushing for these long-term structural, policies, we also want to think about what are the things that we as individuals can also do. And so one advice would be definitely subscribe to BLLX and see if there are any experiments that could be helpful to you. And I'm going to let Roselyn finish up with the last. Oh, okay, I'll keep going then. And finally, know your rights. Check your policies when you're hired, or when you know there's a major life event coming up, or even if you don't. Maybe it's a good Sunday and you have nothing to do. Maybe we could all take some time to read through our policies to see what are our entitlements, right? What can my my employer not deny me? And then think about what you need to do to get access to those benefits, and definitely try to take the next steps to make sure that you can secure them.
Thank you. And I think since we were getting close on time, I'll have this be the final question, and it kind of builds off of some of what you've shared already. But as folks are listening to this and maybe feeling moved to get involved, to make change, whether that be at UC San Diego or in the community, whether that look like cultural change or getting active in policy change, could you maybe each share a little bit as we close out about just kind of how folks who are listening and want to advance change in this area, some things that they might be able to do around cultural or policy change to create the better world that we're all kind of working towards?
Definitely. Well, Jahdziah already talked about Better Life Lab experiments. I think that is a really great start for culture change at home. But also my call to anyone who's interested in researching this or learning more about it through the policy research side and has their own story that they're doing, write about it. Share your story, put it down on paper. Never underestimate the power of your own story and your own experience to relate to others, and then tie that back to the change that you want to see. So if your problem was that you were fired because you had to take time off work because your kid was pulled out of school and you're doing remote work and remote caregiving, and you were let go because of it, write it down and write about how paid caregiving leave can help and make those connections. Put it out into the public. Don't be afraid to pitch. Journalists, media sources, they're always looking for more and more content of personal narratives and blog posts and changing the cultural shift and the dynamic there. The other thing I'd say, I've seen letter campaigns be very effective. So just having a lead organizer write a letter and then have it signed off by as many people as you possibly can, as diverse a group as possible. Don't exclude people just because they might be contract workers or in another program or anything like that. Really bring the community together as much as possible to advocate for these change, because the more voices you can add to your own, the more you can amplify that message. And then, as Jahdziah said just before, vote, go out there, participate in your civic engagement, whether you've agreed with the policies that we've said here today, find the ones that work for you and go out there and vote for them. And just participate in active engagement with understanding the news and understanding how what is being passed affects you directly. Relay that to your colleagues and relay that to your family members. Don't leave your loved ones behind in these research sprints, because sometimes it might be that we know so much just ourselves, but if we told our siblings or if we told our cousins or even just our friends down the way, that we can really create the culture change to really show that care work is the work that keeps all other work going, and it's absolutely essential to, it's a cornerstone of our economy.
Yeah, Roselyn, you really tied that up nicely. So I might just echo a few of the points that you brought up. But I would definitely emphasize again the importance of sharing your story and sharing your experience. I think a lot of times we can feel that we might be alone in this particular challenge, especially when it comes to caregiving, because for so long it is something that has been invisible and it has been hidden, right, from larger society and from our workplace environments. But the reality is that so many people, especially right now, are grappling with the challenges of balancing their work responsibilities and the caregiving needs. And I think it's important to be vocal about that, right? And so Roselyn shared a few ways that you could do that. But I think really in conversation is one helpful way to do that. And the hope is that there will be an understanding of the need for larger policies, both in the workplace, but also within society, to support all workers, regardless of income, regardless of family makeup or status, regardless of type of work that is being done. This is a universal need when we're thinking about like caregiving. And then I would also encourage you to reach out to the Better Life Lab. If you have a personal story that you would like to share, if you have research that you came across and you thought was very interesting, part of what we do is we translate what's out there and share it with the wider public. But we also use real stories from real people just like you to demonstrate the need for policies and share that widely. And we'd also say, vote, vote. There's never a time when that won't be part of the answer about how to, create the society and create the conditions in which we can all thrive.
Thank you, Jahdziah. Thank you, Roselyn, for those important suggestions and ways that we each can get involved in creating change. And I'm really excited to check out the Better Life Lab experiments. That sounds really cool. And I know we shared it in the chat, so hopefully some of the attendees participating could check that out too. So that concludes our Q&A session for today. So I'm just going to go ahead and wrap us up. And just once again, big thank you to Roselyn and Jahdziah for sharing your research with us, your reflections, your expertise. It's so appreciated, and I think just gives us all a lot to think about as it relates to issues of work-family justice and gender equity and how we can make change now and beyond. So with that, I want to thank you all for joining us today for this critical conversation on creating work-family gender justice on campus and beyond. I hope that you will continue to engage with these conversations and explore ways to advocate in your spheres of influence on these important issues. Once again, thanks to Roselyn and Jahdziah for joining us today and for sharing their work and insights with us. I invite you all to check out the remaining programs taking place as part of Women's History Month at UC San Diego. And join us as we continue to celebrate the many contributions of women in our communities, and as we continue to imagine a world where gender justice is embedded in all of our policies, practices, organizations, and culture. So thank you again for joining us today. Have a great rest of your day.